All right, welcome to Inhermost, episode 2. My name is Jasmine.
And I'm Brittany.
Robin.
So let's give her a proper introduction.
Yes.
So today we are shooting in a mastectomy boutique located in Sandy Springs called Sheri's Finishing Touch. As she said, this is Robin, the owner. She's going to go ahead and tell you a little bit about herself as well as the store.
Hello, thanks for having me. My store is basically a breast surgery recovery boutique here in Sandy Springs. And I opened this store because I lost my sister to breast cancer at the age of 34. She was diagnosed at 28. While she was pregnant with Brittany, they located the cancer in one breast during just a regular self-breast exam. And so that's what made me come up with this concept, because back then, even though it was 20 years ago, it was such a struggle for her, being a young woman, trying to find things to still have self-confidence and feel good about yourself, even though she was about to face losing one of her breasts. So it began the journey of me trying to find products available for women that they needed once they had surgery. So some of the items that, may be needed, which would be like their leisure bra, mastectomy bra, drain management. We have the hats and the chemotherapy turbans. I always carry the seatbelt chest buddy, which is a garment that is designed for your seatbelt to protect the wound site from the pressure of the seatbelt in your car. Those are just some of the things that we carry. I know
You would never think about that.
People just don't realize there's so many things that are not thought about that women face when they go, through this. So those are some of the items that I carry, and this was my dream, and this is why we're here.
Well, it looks amazing.
It is. It's such a cute shop.
Yes. Well, thank you.
And you're available online as well, right?
Available online, yes. It's sftstyle.com.
Okay.
Nice. Well, the reason why we are doing this is because obviously it's October, and it's Breast Cancer Awareness Month.
So we're having the Boozy Boob on the Boob Tube.
Yeah, so on today's show, we were thinking breast health, early detection.
It's a good topic, especially for millennials.
Yeah, because it's just something, like, I'm not that knowledgeable, so we couldn't.
Yeah, it's something that's not talked about a lot. So I find that a lot of young people, such as you don't understand a lot of things that reflect or speak to breast health. You don't really start talking about breast health until your 40s. Well,
when they give you that first mammogram.
Exactly. And it's something that basically we should really start paying attention to breast health in our 20s. You should start becoming familiar with your breast. And when I say becoming familiar, you should stand in the mirror, your arms to your side or on your hips. You should examine your breasts in the mirror. Look at the shape of them. Look at the size. You want to look at your nipples. You want to just observe your breast from a normal state. Because when things start to change or become different, if you didn't take the time to really know your breast, you won't notice a difference. You won't notice there's a problem, occurring. And as we all know, with breast health, the first thing is early detection is key. When you get diagnosed with cancer, unfortunately, if you ever were diagnosed, stage 1, stage 2 is a stage where women can have treatments, chemotherapy or radiation, and the outcome is great. Sometimes women don't realize they have cancer until stage 4, and that's where the cancer has gone to the furthest point. And sometimes chemo or radiation is just not going to be helpful in some stages. So that's why it's important to be very familiar with your breasts at a young age, which is in your 20s, because our breast tissue, they start changing from adolescence to menopause. So if you're not paying attention in adolescent years, then when it becomes menopause time and you start, because you will experience some changes, let me tell you, come menopause time,
The change.
there will be some things going on. And so if you don't pay attention, you won't, pick up on if there's a problem or something going on. So yes, definitely start early 20s paying attention to your breast. Lay on the bed, and not doing I'm sure you all have done breast exams before, or have the doctors taught you on how to do them or anything. But when I say lay on the bed and just get familiar with your breasts, it's just feeling them, feeling where your lumps are, understanding to know the shape of your breast when you lay down. As I said, so if something happens, you won't freak out because you decided to do it now at 30 and you're like, oh my God, what is this? But actually that was there when you were 20.
Okay.
So get familiar with your breasts.
So how often do you suggest like a self breast exam?
Once a month.
Once a month.
Yes, once a month. A lot of women do it on the first of the month. It's just easy. You remember the first of the month, it's time for me to do a self breast exam.
Rent, check your boobs.
Right.
Pay that rent, check your boobs.
That's great. Okay, I like that. I like that. That's a great way to remember. Because if not, we'll be hopeless and our boobs will be
jacked.
I can't deal with that. I really cannot.
When you trying to take something, come make this.
Oh, goodness. So yes, make sure. So you want to look for lumps, lumpiness, changes within your breast, color of your breast, changes in the nipples, discharge from your nipples, or persistent pain. Those are some of the things that you would
What
look
about
for.
itchiness?
Itchiness can sometimes I did not know that, and I went to a seminar a while ago, and this lady thought that she was just having like this red rash, and come to find out it was breast cancer.
Oh my God, I always resorted itchiness to their growing. Ain't that what they told you when you were younger?
Yeah.
Like, oh, my boobs are
My
itching.
boobs itching. I'm
They
like,
Let me tell y'all something about grandma myths. Right. We all have grandma myths, but go to the doctor if something's not right. Okay?
So your boobs should not itch. That's not
Right.
That's not what we want.
Yes,
We don't want
yes.
itchy boobs.
Okay,
cool. Good
So
to
the
know.
only way you can do the exam is laying down.
No, you can do it laying down. You can do it standing up. Either one. Like I said, you can stand in the mirror with your hands on your hips and get to know your breast. You can lay down because when you lay down, your breasts take on a new form.
Yeah.
So that's why it's best to check standing and laying.
Okay, so you should do both.
And I guess when you go to the doctor, you're kind of like leaning back on that.
When they're doing, when
Yeah.
they do, because at the, what
Breast
is it,
exam.
your annual pap smear.
Mhm.
Like
Yeah, they
like
do that.
The pelt.
Yeah.
patting. And where do you pat? All the way around?
Yeah, you usually start, if I remember correctly, in the center, and you work your way out.
Okay.
So
Okay.
you start
So
in
you
the
start
center,
at your
and you
nipple
just
and then kind
just
of-
rub your hands around like this, all the way around. Firmness, because you do want to be able to feel what's going on. And we all have lumpiness and things that feel
Yeah,
like.
because I'm like
it's
feeling
something.
mine right now. And I'm like,
Yeah,
it's
like,
a little lumpy right here, but it's a little painful.
And that's
but I don't know what that
fibrocystic.
is.
That's what they call fibrocystic tissue.
Oh,
And
okay.
fibrocystic tissue is a thick, dense mass of tissue within the breast, and things that can aid to that would be such as caffeine. You don't want to drink a lot of
Did
Coke.
hear that. I went to the doctor because I was
Caffeine.
saying my boobs were really sore, and they were like, "Well, how much
much?
coffee and caffeine are you drinking?" I was like, "Oh, I drink a lot of
Yes.
soda."
Yes.
And they were like,
That's
"Cut
it.
back.
Right. Yep.
You should cut back."
So that is a very important factor when it comes to our breast health, is cut back on your caffeine intake. And they even tell you, I don't know, I remember years ago when I went for my first mammogram, and they were like, no caffeine like 7 days prior to my mammogram. I don't know if they still tell that. I don't think they do.
When I had mine was a couple years ago. They didn't say that.
I remember they used to tell us that, no caffeine 7 days prior, and women would be like, what? Drink caffeine?
I need
every
coffee.
day.
I need my
gotta get
coffee
day
before I go to
started."
work.
Exactly. So caffeine is a very factor, a big factor.
Robin's gonna show us how to properly do a self-examination standing up.
So you can stand in the mirror, and what you want to do is start in the center with your 2 fingers together, and you basically are just going to palpitate starting from the nipple outward as you go across the breast. You should, if you feel anything that feels like a pea-sized nodule or a lump, those are the things that you're looking for. Like I said, you're going to have lumps in there, but once you get to know your breast, you can say, oh, that's
know what's
normal.
normal.
I know that's, I know that's there. That's a part of my fibrocystic tissue. And they would just all the way around until you just go all the way to the circumference of the breast. And you also want to lift your arm up, and you want to check here on the side. Can you all see that?
Yeah.
Okay. Right here is where our lymph nodes are, so you want to check in this area too.
And that's typically where, when they first discover it, where
Exactly.
where they find it.
Is right here on the side. So you want to palpitate in this area too to see if you feel anything. You will feel tenderness. A lot of us do have tender breasts, but yeah, that's normal. once you have it checked, if you have tenderness, always have it checked first. But once you know it is something that you will always have, I actually talked to my doctor about it, and they recommended vitamin B, I think it was, that helps with tenderness of the breast. Vitamin B.
Perfect. All right, so now that we got a nice little self-examination.
Yes, exactly. So have you ladies had mammograms before?
I have not. The only thing I had is when they like lay you on the thing and they do that.
On the table, just the self-exam during your yearly annual.
I actually have had a mammogram because, you know, I have breast cancer history in my family. My mother passed. So my doctor recommended that I go get a mammogram 10 years prior to the age my mother passed at. So she was 35. So I got my first mammogram when I was 25, which was about 2 years ago. And I don't know, it was like intimidating and like just nerve-wracking. I was really like nervous and I didn't know what to expect. Like, you know, you hear everybody like, oh, I gotta get my mammogram. Like, oh,
Boob squeeze, flat pancake.
Yeah, like I was just like, oh my gosh,
that sounds
the whole pancake thing.
like for real. So I went in there like, and then you walk in this room, it's like these machines. I'm just like, what's gonna go down in here?
And it is an uncomfortable process. I mean, they put you in that machine like a pretzel, and it's like you know, they want your
like your arm gotta be here,
across here,
and then your boob has to sit on the plate.
Your boob up, and they put it on,
and
the
then
plate.
they put another plate on top of it and like squeeze it,
and then you gotta curve over the machine. Yeah. So it's awkward.
And you gotta hold it while they go back behind the computer, and she like, I'm never getting a mammogram.
Oh my gosh, I will self-examine. I just pat my
but it only takes a few seconds.
Yeah,
it really did.
It is over really quickly. I mean, I'm pretty sure we've had more painful things, like a shot. You know, maybe not a shot, but I don't know. You know.
Yeah. I just think of like the pap smear because that's like.
Yeah, you could get a pap smear, you could get a mammogram.
That's intimidating. When I first got one, I was like, why did y'all bring me here?
Right.
What are we looking for?
Like, what are you looking for? She said, what are you looking for? What are you looking for?
I can just imagine like having my. What? That
Girl.
just sounds
yeah, it was nerve-wracking. Like, I honestly was like just sweating and like almost in tears. I think it was more of like an emotional thing going on, but it was like really intense. I'll say that.
Yeah.
But you know, when I got the results, everything was okay. They said that I did have really dense breast tissue. I don't really know what that means, but
very thick. That's when like I said, you feel like everything feels lumpy. Everything is, you know, it's just thick, dense tissue.
Okay. Yeah, but they told me
and you find that in young women.
Yeah.
You know, because that's when our breast health is, you know, when we're perky. That's when we're perky. Exactly.
Just kidding, because I'm far from it. Ooh,
shout out to the bra.
Shout out to this t-shirt, bra.
But yeah, I did have one. It was, you know, it's not that bad. It's over really quickly, and you gotta get it. You need to know what's going on, because
the earlier the better.
You just never know. You really never know. Because
go ahead.
My mother, I don't think we had any other history of it in our family. It was just like, she was just like 1 in a million.
Yeah.
So you know, it's you want to stay on top of it because it could be anybody.
Do they say like you have to keep going?
I think you go every 5.
Yeah. So you started at 25 and you have to go every 5 years.
Something like that.
Okay.
Right.
It may not be 5.
So if you have strong breast cancer history, they usually will start your, like you said, 10 years prior to whenever your mom was diagnosed. Or they say 35 years old at least start by having them. Because from 35 to 40, you usually start at 40.
Okay.
So from 40 to 45, it's every year. From I think it's 45 to 55, it's every 2 years that you have them done.
So if you wanted it before then, it would kind of be a request.
Right.
Like exactly. I would like to get a mammogram.
Right, and then they would want to know why, and because your insurance isn't going to cover it, and that's the thing that they're looking at, is that we don't have any family history, so we don't have a reason. But like in your case, I'm sure they covered it because you have strong family history.
Yeah.
So doing a mammogram on someone who's 22, they covered it, but they normally don't.
So if my grandmother had, that's not like a strong family history because my mom didn't.
Right. They would be like,
that's crazy.
Yeah.
Because I don't think anyone had it. Well, I mean, my grandfather had prostate cancer, but like.
Yeah, I bet with it being just your grandmother, they probably would just have you follow the standard guidelines.
Okay. Because I'm like, should I be concerned?
Yeah. So, But yeah, you normally start at 45 with your annual mammogram.
Okay. And then does it come with like your pap smear, or it's a completely
They
separate?
send you somewhere
They
else.
send you some, but that's when you get the order for it, because you can't just go have a mammogram. You have to have an order in order to have
when they send you for lab work, they have to
Oh,
send
it's like
you
the
send-
same
yeah.
thing.
Same process, right? You can't just go and get a mammogram
Learn
on your
something
own.
every day.
Right. So yeah. What else about mammograms? And then there's the BRCA test. It's BRCA. I don't know. You may have heard BRCA. You ever heard the term BRCA? That's a gene test that they do now to determine if you have a strong hereditary gene
Oh, that's
of
what
breast cancer.
how Angelina Jolie found out.
Right,
When
she
she decided to undergo her double
Right.
mastectomy.
And they recommended for me to have the BRCA test. I'm sorry, I haven't had it. I know I should have had it, but sometimes you just rather just go with the process. I go
Ignorance is bliss.
yeah,
that
some kind of
thing.
something like that. But I mean, when you think about it, I mean, you have to really think about it. It's like, okay, I could find out. Yeah, you have the gene. Now, what am I going to do with this information?
Yeah,
Right.
freak out after.
Right? Am I going to
or-
be stressed the rest of my life knowing that I do have this gene? Am I going to do what Angelique did and go and just do a radical mastectomy and have both removed? I mean, you have to figure out what you're going to do with that information once you get it.
That's
so
true. That's true.
I was more like, okay, let me just be proactive as far as breast health, do my breast exams, do my mammograms, and if something comes of that, I'll take it from there.
Yeah.
But to go and have a test and someone tell me that, yeah, you have a gene and it's a possibility that you may have it, I felt like that was just too much of a burden that I didn't want to carry.
That's true. I probably do the same way. Like
That's my choice of why I have not had the BRCA, even though my doctor has told me they would like for me to have it. I haven't had it. So that's the lady. Anywho, but yeah,
so late.
so yeah, that's it on testing.
So I guess let's talk a little bit about what breast cancer is, and I guess the different stages. Because I mean, I think I'm familiar to a certain extent, but not really.
Well, of course, it's cancer of the breast. We know that much.
Yeah, we do.
Just to break it down.
Right. And there's breast cancer can be caused by environmental exposure to sunlight and pollutants, soot, wood, dust, arsenics, just to name a few.
Just living, basically.
Just living. basically.
Yeah, like everything.
So you're at risk.
Exactly.
Just living.
Everything. So you just never
I heard
know.
alcohol too.
Yeah, they always tell us to limit our alcohol intake,
As we sit.
Yeah. But there are things that do lead, that about your lifestyle that you really do need to control. That's such as eating a poor diet, inactivity, obesity, heavy alcohol use, tobacco use, including smoking, or exposure to chemicals and toxins. Those are some of the things that they associate with breast cancer.
Okay.
So that you want to, keep in mind.
Interesting.
So, but yes, and there's many forms, there's 4 stages of breast cancer. I don't know the technical breakdown of them, but there's 4 stages of breast cancer. You probably hear when people get diagnosed with breast cancer, first thing people say is what stage, are you, or is it? And it's, 1 through 4, 4 being the severe of them all. I'm not sure if there's a stage that if you have stage 4, I do believe when you have stage 4 cancer, they do like a chemo radiation combination. In the other stages, maybe 1 through 3, some women just do just chemo, some people do just radiation.
Oh, okay, so it's not the same thing.
Right, chemotherapy and radiation therapy.
I thought they were the same.
Right, so it's all depends on which ones, which treatment option that, women do. I remember when your mom had breast cancer, I don't know what it was, but I remember she used to, of course she lost all of her hair, and they used to put this ice cap on her head when she would go in for her chemo treatments. And I don't know if it was something to do with preserving the hairline. I don't really know, and I guess I need to look and see why they did that. But she used to wear it. They would pull it out of the refrigerator, and it was a little beanie cap, and it was a refrigerated cold pack. But I don't know what it was.
Maybe it was to stimulate regrowth or protect our hair follicles from the.
I don't know, but I do know. I don't know what, and none of this is a joke, but find likeness and things. But whatever they put in chemo radiation, they need to bottle it for us sisters, because your hair comes back gorgeous. And even in Caucasian people I've talked to, your hair comes back a total different grade.
Yeah, and it comes like a different color too.
Different color, different grade. It usually comes back curly and soft is usually what it does. And
kind of like different redo, colors. Like baby hair.
Yes, it is amazing.
And it stays like that for the remainder of your life.
It stays like that for the remainder of your life. My sister's hair was gorgeous. I mean, she had really thick hair like Brittany's hair, but when her hair came back, it was just a really curly, soft, like baby hair, like you said. And so yeah, she went natural after that because her hair was so pretty. And you find that a lot of sisters go natural after it because their hair is so pretty. You know, the lady that was just in here, you know, with the yoga lady. Yeah, you know, she said she never wore hair like that until after her chemo radiation because it was so pretty. She just went with it. So
I have a question. What is a breast cyst?
A cyst is, you can have a cyst on your leg. You have, you know, a cyst is a nodule, basically. They're going to always test it to see if it's benign or cancerous. Sometimes we receive cysts, you know, it's just a growth part of the breast. It could be, like I said, a growth could be anywhere. But
so it's not, it technically may not be cancerous.
No.
But
can you feel it if you're doing the examination? But normally they don't move.
Right, they don't.
So you would kind of know because they're painful to touch too, aren't they?
Right. Well, some are. Some. That's the whole difference about all of different types of cancer, tumors, nodules, cysts. Is some it may hurt for you, it may not hurt for me. It may move around a little bit for me, it may not move. You know, so it's different things for different women. So it's really hard to determine. That's why they always say it's just best to have it checked to know what you're dealing with because you just don't know.
And the cancer, it's like, I know this is maybe a silly question. It's not technically always going to be in like one particular spot. It could be anywhere in the breast.
Well, they do, yeah, what they do is after you're diagnosed, that's when they're going to do probably an ultrasound or MRI because now they want to see, is it just a localized tumor or something that you're dealing with, or has it spread to the lymph nodes? Because a lot of times you hear women say it has spread into the lymph nodes, so the cancer, sometimes they have to go in and do a radical mastectomy, which is the removal of the breast, which includes the lymph nodes. And a lot of times women have more difficulty or side effects when they remove the lymph nodes. I don't know if you ever heard of lymphedema.
Yes.
Which is the swelling. You ever seen a woman with a huge arms? And that sometimes has to do with the draining of the lymph nodes. And that's something that I've been learning about last couple of months is it doesn't really go away when you have that swelling in that arm, you know. They make, you know, a brace or a compression garment for it.
To kind of keep it.
Yeah, to kind of manage the fluid in there.
Does it hurt? Is it painful?
From what I'm hearing in the research I've been reading, I've been doing the last month or so, that it really never goes back to normal once you have that. So, I don't know. Yeah, I don't think it's painful in the arm itself. It's just it's really swollen. It's just fluid.
Yeah,
it's just full of fluid is what it is. You know. So yeah, but you know sometimes you have a full mastectomy. Sometimes you have a partial mastectomy. Sometimes you just have your lymph nodes. You know, they may remove some of the lymph nodes. It all depends. After they diagnose you with cancer, then you go through the testing to find out actually what treatment they're going to, what course of treatment they're going to do.
Well, I don't know if you would know this information, but do you think that more women are opting for the mastectomy versus
treatment, versus chemo and therapy? I mean, it's 50-50. It's a personal choice, and you find some women that feel that breasts are not important to them, you know. But then you find women that feel like breast makes them. That's what makes me a woman. So they don't want to, you know, lose their breast. So it's a personal choice. I really don't know if, you know, more people are opting out of mastectomies or not. I do know that it seems to be a trend right now that women are going for the reconstruction surgery after. Which is also a risk because when you, which they tell all women, when you put in implants, you have to think about that because now you're putting in this foreign object that's masking your natural tissue. So sometimes things are not picked up as easy as when you don't.
Because once you're diagnosed and you go through what is it called when you not recovery but
remission.
You still have to get examined to make sure. You have a lot of follow-ups following that. So with the actual silicone or
Mhm.
gel,
Implant
whatever
in there.
implant that they're using,
Right.
you can't really, it's harder to read.
So I think, I'm not sure, but I would imagine they probably do MRIs with women who have breast implants just because they're able to see more than a regular mammogram. Yeah. I had a lady come in last week and she's getting ready. She was diagnosed with cancer probably 5 years ago. She had breast implants put in and she's getting ready to go through, have surgery October 8th. And she has to have the breast implants removed because the cancer has come back. And also the implants ruptured, which she became ill. She started having the joint aches. I don't know if you ever hear women talk about silicone implants and how they start having joint pain, and they just start being really, really sick because that fluid, that silicone is now within your body. So she's dealing with a double mastectomy because it's the second round, and on top of it, she had the implants put in that she now has to have removed. So she was in here last week, and surgery is October 8th for her to have her implants removed, and basically it's like having, like she said, it's like having another mastectomy.
Right.
You know?
So technically, excuse me, not even technically, so clearly a mastectomy is not gonna remove the cancer.
That's not the end of
cancer.
it. Yeah,
Yeah, so
So I guess you can do both too.
You know,
or you get the radiation or chemo and you do the mastectomy just to be on the safe side.
yeah, I guess, well, like you said, it depends on what stage cancer you have. Or if you just opt to say, even though you have stage 1 and you tell your doctor, I still want to have mastectomy because, you know, I just don't want to. And of course you can't have breast cancer if you don't have any breasts, you know, but when women put these implants in, then you're forming that cavity again, you know, so I guess this is what's going on with her, you know, that she put them back in, and now she's dealing with this whole cancer issue again.
I can't even
So, yeah.
That's tough.
It is, it's tough. And it's, you know, for women, what makes us feel like women, our hair, our breasts, you know, it's those
to lose
things.
both.
And to lose both is something that's devastating. And that's what I hear women talk about most, is that the things that identify themselves as women is what they no longer have. And that's why I carry eyebrow tattoos for women. I tried to have everything in the store to regain their confidence, their self-esteem. There are things that you have available to you as a breast cancer patient. So I'm going to start with breast prosthesis. This is the breast prosthesis. Let me tell you, 20 years ago, these things used to be like a paperweight. Now they're very light, as you can see. Light.
Oh wow, they're like
natural.
very.
Yeah, they feel like breasts. Exactly. See,
It's
she's
the
like,
it's the same. It's really short the same.
Oh wow.
yeah, because
Like
they still want
it's
them
like
to have
memory
it.
foam.
Mhm.
So
They still
these
want to
come
have
in
it
like
filled.
sizes.
They come
like,
in. When you come in, you'll get a measurement, and we can give you the proper size. And sometimes women have, as I was speaking before, they lose the side wall because they did a radical mastectomy, which the tissue on the side. So you would get a breast prosthesis that actually has another piece of tissue that comes out over here that would fill in
Oh, okay.
the area over here. So it's an asymmetrical breast form, they call it. So it's tissue all the way around. It's another wing like to it. Look like almost like a chicken. Yeah, look.
Chicken.
No, she didn't.
It looked like a chicken. Just a little.
So,
She threw that in there like.
wait. And then we also have these, which this is a wonderful organization out of Seattle, Washington, called Knit Knockers. It's a group of women who knit breast prosthesis, and these are free. And you can find a supplier. I'm a supplier of these. You can go in and pick them up. These are great for like yoga, because you don't want this heavy or this form when you're doing yoga. You can put this inside your bra and still have uniformity, when you're in your workout. Because sometimes you have on your little tight tank top, you don't want to be looking lopsided or whatever. So, and I've even had women that come in here because, I don't know, do you all know that some women do have different size breasts?
Yes.
Okay.
I did know that.
I was born that way. I have different size breasts.
I do too.
Yeah. So, some women buy these because you can go in the back, you can take it out and make it as small as you want.
And like perfect.
Right. So you can make it full, you can, make it a little thinner, make it whatever size your breast is to
It's
fit
like a
your,
little pillow.
yeah,
For your boobs.
basically.
Well,
And that, this is a mastectomy bra, and I have the matching panties available.
So cute.
For a lot of them. But basically, let me see this. This is, a mastectomy bra has a pocket. Turn it to the side a little bit, Britt. has a pocket, as you can see here. And what you do is you just slide your breast form in. And that's what makes it a mastectomy bra, because there's a pocket. And then you just
now
adjust
you have
it.
a full breast.
Yep, and you adjust
Oh wow,
it.
it looks really good in the bra.
And so then that's and so you can either wear this form or you can wear this form. They make all kind of forms. They make swim forms for women that are swimmers, that because with chlorine and different things, or sea salt, not sea salt, saltwater pools, they have different material for those.
Okay,
You know, so they do make forms especially for swimmers.
Okay, so you
know.
can like literally get a form to whatever you need or whatever you got
For
going.
active women, whatever your active lifestyle is, they have a form for you. And these come in different colors. When my sister was diagnosed with cancer, and that was the early 90s, they did not make breast forms in different colors. Today, they make them for us African American sisters. Thank you.
Not the
And then she said, thank you.
we appreciate you.
Thank you.
Okay, so that's your bra form. So we have chemo hats for when you lose your hair. A lot of women sometimes just wear scarves or turbans. You can wrap your own scarf to get a little nuance knot and whatever. But these are chemo hats that I have. And then we have baseball caps and different things like that. There are hats that are made that have the actual hair sewn in that women can buy.
Oh, it's like if you got like a baseball cap, you would have like.
They have a bob.
Oh.
Yeah, and then they have one where there's a ponytail that comes out the back. If you don't have any hair, so like you go into your kid's soccer game, you know, you don't want to wear a hat or anything, they do make like a baseball cap with a ponytail that comes out the back, you know. So you can look like Will and Mary Bob a little bit. So, anyway, this here is what they call the breast buddy. And this is made for your seatbelt in your car. So this is something people don't think about, that seatbelt is going across your surgery site. Your surgery site can stay tender and sore for up to 2 years. I had a lady come in here, she had surgery, I think it was like 15 years ago, and she talked about how sensitive her skin still is in that site. Wow. And so she bought one of these for that. And it's just basically it's just a little pillow, and you just slide it right up under your seatbelt.
So it's like a nice cushion.
A little cushion over your, And so then now you have this where the seatbelt is not directly on that chest wall for that. And then we have eyebrow tattoos, which come in different colors, different shapes, different sizes. What you can do is you can trim it to make it shorter if you want, and basically you just cut it out, and you, it would be this, it's hard for me to do it because, okay, I'll do it like this. You would put it, match it up to where your eyebrow would go, and you would lay it on your forehead, take a hot rag, and put it on top of it. It's just like putting on a tattoo. And you just lay that hot cloth.
And we one of those little temporary.
Yeah, what was it, the Cracker Jack box?
Yeah,
exactly. You would just, then you just lay the towel on there, and voila, you have an eyebrow. Take a little finishing powder, brush over the top of it to kind of blend it in, and you can have eyebrows for the evening out, date night.
How long do they last?
Date night. These were 7 days. You can wear these up to 7 days. Yeah. So these are great for if you got an event to go to or you don't want to draw them in. I have women that buy these that don't even have cancer, but yes.
I was just thinking that, like, yes, I can use that.
This item here, this is what you call your compression bra, and for when you have breast implants put in. This is a compression garment, and of course any bra that you want a front closure or a zipper, because it's just easier, because when you have mastectomy or any type of breast surgery, it is very hard for you to reach. You can't raise your hands.
So you wanted something that you can just kind of
put your arms in and be able to close in the front, so that's why you find most of their garments are all front closure. A lot of women have to go to occupational therapy after breast surgery, because after mastectomy, I want to say it, and I'm not sure, I would have to check, but it's several weeks to months that you cannot raise your arms above your head,
I think I kind of had that because I had a breast reduction, so I remember like having that soreness.
Yeah, and they can't raise it.
You don't realize how much you use your boobs for, like not even
like just
for them being there, they're affected by everything,
by all movements. Exactly. So this is a garment that you can either step into or you can zip front. and it has pockets as well for the breast prosthesis. But this is a garment that you would wear after breast reconstruction surgery. Your doctor usually wants you to wear some type of compression garment. It helps with the implants. Once you have the implants put in for migration, they usually will rise. So there's a belt that actually comes with this that goes across to kind of help the implants settle in. So you wear this. I think this is like 3 weeks that you wear a compression garment. And then we have the drain management bra. When you have a mastectomy, you will have tubes because you have drainage, fluid drainage after surgery. And so this helps with the drain management. The bulbs that are attached to the tubes will go in here, and then the tubes will be into the incision site.
Okay.
And that's where your drainage comes from. And of course it has the front closure as well, but this is what they consider a drain management bra to help you with your management of the bulbs. This is a shower shirt, which was invented by a lady who had breast cancer, because after surgery you can't get your sites wet for at least 3 weeks. So this allows you to be able to take a shower or wash your hair. So it has elastic around the neckline so that the water doesn't come in, and it also has the drainage system, which I showed you on the previous bra. It also has the drainage management system in here, so you can actually get in the shower with your drains, which is very convenient. So,
And it's cute too.
Yeah. And you said you have that in black and white, right?
I have it in black or white.
And it's one size
and it's
fits
one
all.
size fits all.
Okay.
Exactly.
Good to know.
So, sftstyles.com.
Right. And we also have on, Jasmine and I are both wearing these pins. She has a lot of little, pins and inspirational jewelry, books, lots of things you can come and take a look. She's in Sandy Springs. We'll put all of her information in the link in bio below as well. You can follow her on Instagram, Facebook, and visit her website. Coming up next, we have a special guest.
So excited.
Is a survivor. Her story is really inspirational. We're going to ask her a couple of questions. Just get some more information from her as far as her journey and everything that she went through, and what advice she has for young women. Stay tuned.